I'm Jasmine Vichet with HealthWatch, where we have the privilege of sitting down with Dr. Melendez to talk about diabetes. Thank you so much for joining us.
Hi Jasmine, nice to be here.
So let's get right into it. What is diabetes?
Diabetes is a chronic condition that affects mostly adults. There's a type 1 and type 2 diabetes. Type 2 is the one that's most prevalent, and it affects those that are 40 and above. But more and more we're seeing it in younger people.
And tell us a little bit more about type 2 diabetes.
Type 2 diabetes is basically, it's a dual problem. One problem can develop when the pancreas is not producing enough insulin naturally. And the second issue is insulin resistance, where the body is no longer metabolizing glucose or sugar in an effective manner, so that overall the sugar in the body is getting higher and higher.
Okay, so what are some of the symptoms of type 2 diabetes?
There's a lot of symptoms, and more people are becoming aware of them. Common ones include increased thirst, and also dizziness, and weight gain, and there's some other issues as well, which would indicate that a person has chronic diabetes at that point.
Okay.
And those common issues are numbness of the feet and hands, and coldness of the feet and hands.
Okay. So who gets type 2 diabetes?
Type 2 diabetes affects a large number of people. There are specific risk factors to look out for. Those folks who are overweight or obese, folks who have a family history of diabetes and their first-degree relatives, those that are inactive, and there's also certain ethnic groups, particularly African Americans, Hispanics, Asians, and Pacific Islanders. It's pretty prevalent, and there are in women who have been pregnant before and had gestational diabetes or diabetes during pregnancy, oftentimes after delivery years later, they're also prone to becoming a diabetic.
Okay. Can it be cured?
Generally, it's something that is controlled or managed. There are certain situations where if you're very newly diagnosed with diabetes, if you put into place some very good health improvements, such as improved diet and weight loss, it can be reversed and controlled so that you're not showing any of the signs of diabetes, and even your lab work looks like you're not diabetic. There are folks who are in the morbid obese category, and if they've had a bypass, sometimes that excess weight loss can also, quote unquote, cure or dramatically improve diabetes.
Okay, so you mentioned a healthy lifestyle. Are there other medical treatments that can cure diabetes?
Usually diabetics are going to be managed with oral meds or insulin. So in general, 2 or 3 medications of oral meds can manage the condition, and when it becomes very uncontrolled, insulin is needed to kind of stabilize the sugar.
So with the treatments, if they can't really control those treatments, what are some of the complications beyond that point?
For diabetes, there's a lot of complications, and something that are very life-changing.
Okay.
So individuals who've had very uncontrolled sugars for usually many years can develop problems with their kidneys, leading to kind of kidney failure and maybe needing dialysis. You're probably aware of folks who have had limbs that needed to be removed, and they start having issues with numbness and tingling, and can cause, without that sensation of hurting themselves, they might injure their feet and develop infections. Diabetes is also one of the most common causes of vision loss.
Okay.
So it can cause blindness as well, and heart disease. So practically every organ system in the body is affected by sugar, high sugars.
Thank you so much for being here today, Dr. Melendez. We'll be right back with more HealthWatch.